The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The groundwork for all happiness is good health. So we are here today in yet another episode of Health World, taking tiny steps towards creating a healthier world. Very good evening viewers, I am Marina Francis. Welcome to BMC Global Live Al Hilal Health World, nothing but lifestyle. According to the World Health Organization, non-communicable diseases, NCDs, which includes heart diseases, stroke, cancer, diabetes and so on, they are the #1 cause of death and disability across the world. We know that it is becoming an increasing concern these days, and that is why we have chosen this as our topic for discussion. And we have with us today to throw light on this topic Dr. Divya Sharma, from Al Hilal Multi-Speciality Medical Center, HID. She has a previous experience as consultant in internal medicine from various medical facilities in India. She completed her MBBS from Hassan Institute of Medical Sciences, Karnataka, and her MD from Bangalore Medical College and Research Institute. She has a vast range of experience in treating acute illnesses like respiratory diseases, stroke, as well as chronic diseases like diabetes, hypertension, and so on. A very apt person with us today to give us insight on this topic. So let us begin with today's episode. Good evening, Doctor. Thank you for joining with us today.
Thank you so much for inviting me for this session.
Thank you, Doctor. So to begin with, we have taken the topic non-communicable diseases. So this term, what does it actually imply?
Non-communicable diseases, as the name itself suggests, that they are not communicable from one person to another person through any infectious agent. They have a very long course. They can be treatable, but they cannot be curable completely. Okay. There are different kinds of the non-communicable diseases like cardiovascular diseases, cancers, and chronic respiratory diseases, diabetes, hypertension, dyslipidemia. There are different kinds of non-communicable diseases. It has a different course of impact on the health.
Okay, so you mentioned few of the diseases. Can you elaborate on the different types of non-communicable diseases?
There are 4 major causes of non-communicable diseases. First and foremost is cardiovascular disease and the stroke. See, cardiovascular diseases mainly includes coronary artery diseases. Coronary artery diseases are the most common diseases in the worldwide, and they have a very high impact on the health. So first and foremost is the cardiovascular disease and the stroke. It has a huge impact on the heart and also the vascular system and the brain. Second most common is preventable cancer. There are different kinds of the preventable cancer. For example, oral cancers and breast cancer and uterine cancers and so on. So there are a lot of preventable cancers. So we need to examine for that, and it has a various risk factor on the body. And third one is diabetes, which is very common here. So most commonly diabetes has disease per se, it has a effect overall on the body. A lot of complications will be there, side effects will be there. So it is always advisable to early identification of the diabetes and a proper management. And the last one is chronic respiratory disease. Chronic respiratory disease per se has different varieties are there. So first and foremost is like because of the environment factor or chronic history of tobacco smoking. Okay. So there are different kinds. These 4 are the major cause of non-communicable diseases which have a lot of impact on the body.
Okay, Doctor. So how concerning is this issue? What is the burden or the impact it creates on our health?
These non-communicable diseases kills around 41 million people worldwide. So around 70 million people die before the age of 70 years. That is like a premature death. That is a major cause of premature death in the world. This non-communicable disease has a impact on the premature age. Okay.
So it's very important that we treat this disease, also find out this disease. Doctor, what could be the causes behind such diseases and the risk factors involved with it?
So as a name, like non-communicable diseases usually cannot be cured completely, but they can be prevented.
Okay.
So it is always advisable to see the signs and symptoms and also see the risk factors which are leading for the development of the non-communicable diseases. So it is always advisable to see the risk factor. The risk factors for development of non-communicable diseases can be broadly categorized into modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are like you have a chronic tobacco smoking, unhealthy lifestyle, unhealthy dietary patterns, and chronic alcohol consumption and lack of physical activity. These are the modifiable risk factor. Modifiable risk factor means you can modify the risk factor so that occurrence of the disease can be preventable. But there are little non-modifiable risk factors also, like age, gender and ethnicity, race and hereditary factors. These factors they occur in the family or in the gender, but that cannot be controllable. They can happen. Modifiable risk factor, anyways, you can control it, but non-modifiable we cannot do anything. So these constitute around 20% of the non-communicable diseases which can happen. So we don't have a control over that.
Okay.
Yeah.
So doctor, how does a person develop non-communicable diseases?
Usually, as I said, there are the risk factors. As I said, there are like unhealthy lifestyle, or taking tobacco for a very long time, or taking alcohol for a very long time, sedentary lifestyles, diet habits, all these factors. If you have these factors for a very long time, and if you are chronically exposed to such toxins or environmental factors for a very long time, your body will react to such changes for a very long time, and it has an oxidative effect. Inflammatory reaction can happen inside the body. So if this happens for a very long time, chronically body will have a metabolic changes like hypertension, dyslipidemia, or change in the blood sugar level. It can have a hyperglycemia, or there could be an increase in the cholesterol level. So these are the modification or changes which happens in the body after exposure to the risk factors for a very long time. So these can have an effect and can finally leads to non-communicable diseases in the form of chronic heart diseases, coronary heart diseases, stroke, hypertension, diabetes, preventable cancers, and chronic respiratory diseases.
Okay. Doctor, that was very insightful. We do have many more queries. Viewers, stay tuned. Also, do share this informative episode to your family and friends. We shall be back after a very short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live, Al Hilal Health World, nothing but lifestyle. Our discussion today is on the topic non-communicable diseases, and with us is Dr. Divya Sharma. Doctor, carrying on with the queries, in order to identify the non-communicable diseases, what are the signs and symptoms we should look for?
Yeah, most commonly the cardiovascular diseases, if you are considering, mainly the chest pain, acute chest pain or a long time chest pain, which is increases on exertion, exertional chest pain we call it as, or exertional breathlessness, palpitations, giddiness. These are all the symptoms of cardiovascular disease, or long term headache. Long-term headache, palpitation, these are all the symptoms of cardiovascular disease. If we have any such symptoms for a very long time, it is always advisable to go and meet your doctor. And considering the diabetes, which is second most common of non-communicable diseases, excessive thirst, excessive intake of food, you are feeling too much of hungry, too much of thirst. These are all the minor symptoms of diabetes, or too much of weight loss, too much of urination. So these are all the minor symptoms of diabetes. If you find any such symptoms, you have to consult to the doctor. So these itself suggests that there could be a changes in the metabolism of the sugar. Okay. Then third most is preventable cancers. So there are a lot of preventable cancers like oral cancer, breast cancer, gynecological cancers like uterine cancers. These cancers can have a different manifestation. Majority can have a loss of weight, loss of appetite, or any mass anywhere in the body, or they can have ulcers, wound in the oral cavity, or they can have a prolonged bleeding per vagina. So these are the symptoms. So they can present with, or anywhere, especially in the GI tract, if they have a bleeding for a very long period, they can present with these symptoms. So if you are finding any such symptoms, you have to consult to a doctor. And last but not the least, the respiratory symptoms. So chronic respiratory conditions like chronic cough or chronic breathlessness, or if they can having a cough with the expectoration. So such condition also they have to consult to a doctor.
So when a patient comes up with such signs and symptoms, how do you go about with diagnosing the non-communicable diseases?
Yeah, diagnosis overall includes the general physical examination. First and foremost is the history taking. Then we have to identify we have to confirm the diagnosis by investigation. First is history taking. History taking is very important. We need to ask the patient regarding their risk factor. As I told before, the risk factors helps in identifying the disease. We need to ask regarding the modifiable risk factor and non-modifiable risk factors. Modifiable, in case of like most common is cardiovascular disease. Is there any chronic chest pain or breathlessness, giddiness? All those things we have to ask. Depending upon the history, we will conclude a diagnosis. And also regarding the history, we need to ask certain signs also. Is there any sign of weight loss or any lump in the body or bleeding? Those histories we need to ask. After history, proper history, we have to do a thorough examination of the patient. General physical examination we have to see see for any signs are there or not. Usually we have to see from head to toe examination. Especially in case of a long-term tobacco consumption or long-term alcohol consumption, we need to examine the oral cavity. Tobacco anybody can take in the two forms, either through the cigarette smoking, that is the inhalational form, or through the oral chewing. There are different formulations are available. They can have a chewing tobacco. So these both things can have an effect on the body. So majority who are having like cigarette smoking for a very long time, they can have a respiratory symptoms. So we need to auscultate the chest to see for any respiratory findings. And for tobacco consumption in the form of any powder or anything, so in the oral cavity, chewing for a very long time, they can have an irritation in the oral cavity. They can develop ulcers in the oral cavity. So usually some patient can have a ulcer for like for a few days. So that we need not have a concern. If the ulcer is persist for a very long time, like more than 3 weeks, 4 weeks, even after the treatment this ulcer is not going, then we should be careful, because long time ulcers can have an effect. So that could be because of we need to, in that time we need to ask the previous history related to the consumption of the tobacco. So with that we can conclude there could be some pathology, so we have to furtherly investigate them. So that is about regarding the tobacco consumption. And toxic consumption of alcohol, that is one of the most common risk factor. So this alcohol will have a very bad effect on the body. Not only one organ, it has an effect for all over the body, including all the organs. So we need to see by history wise and also examination. So majority of the patient, if there is a history for a very long time, like more than 8 years, 10 years, they can have an effect. Short period, they may not have a symptoms, but sometimes if there is a binge drink, they can have a toxic symptoms related to the central nervous system. So that also we need to ask. Long term history, you should see for any liver involvement, like jaundice is there on clinical examination, or on abdominal examination, you can see the enlarged liver, all those things you have to, or weight loss is there, or any loss of appetite is there, we need to examine that. Okay, that is regarding the alcohol consumption. Those two are the major causes for that. And coming to other cancers like breast cancer and vaginal cancer or the pelvic cancers. Breast cancer, we have to see for any lump in the breast. We have to examine, especially in female, we have to examine is there any lump in the breast, or because breast cancer, if it is identified early, we can cure it. So it is always advisable to examine breast, both the breast we have to examine. Okay. Then coming to the vaginal cancer, that is gynecological cancers. So we need to do the per vaginal examination. So see for any growth or any inflamed area, we have to examine and we have to see. They can present with the chronic bleeding. So if such history is there, then we will examine female for that type of cancers. Okay. So and considering the other diabetes, hypertension and all, it is always mandatory to check the blood pressure, because hypertension is a disease where you may not find any symptoms at all. They will be like as normal as usual, they may not have a symptoms. Rarely around 10 to 20% of the patient can present with the symptoms like chronic occipital headache. They can have a headache here, occipital region. So chronic occipital headache or blurring of the vision. Vision can be, sometimes they can have a blurring, or history of fall. Because of the giddiness, they can have a history of fall. So those symptoms, they are little dangerous. Always it is advisable to consult a doctor if you have such symptoms. Okay. Then whenever a patient comes with that symptoms, we will examine for a blood pressure. So if the blood pressure, if it is higher side, that is the reason for their symptoms, we need to treat accordingly. We should not neglect such symptoms. Okay. That is considering the hypertension. Then one of the last and most important is diabetes. So diabetes nowadays, it is increasing day by day, and there are 40 million people around the world. There are like lot of patients, they coming with the history of diabetes in the family also. So whenever patient comes to us, we always ask the history of like family history is there, hereditary history is there. There are different kinds of the diabetes actually, like type 1 diabetes, type 2 diabetes, or diabetes which is happening in the pregnancy. So majority we have to, whenever they come with the symptoms of diabetes, as I told earlier, like excessive thirst or loss of weight, or they can have excessive urination or excessive hungriness or everything. No, if they have such symptoms, we will further investigate for diabetes. Okay. So we can divide accordingly whether it's a type 1 or type 2. Briefly, if you want to divide the type 1 and type 2, type 1 is mainly insulin dependent diabetes, where usually it happens in a younger age group. They need a insulin for the treatment, and it's mainly because of the deficiency of the insulin secretion. So in a younger age group, usually they will be detected earlier, because insulin deficiency condition, their manifestation will be earlier. But type 2 diabetes, usually it can happen in a little later life. Okay, so they can present with, they may not present with the symptoms. Majority can have the symptoms in a later stages. They can have, as I told, all the symptoms like weight loss, difficulty, like increased urination, micturition, everything. So that time we have to give a blood test and see for a high sugar levels. Okay, so that is about the type 2 diabetes. And the one more thing is that diabetes during the pregnancy, that is very important, because pregnancy is nothing but there will be hormonal changes will be happening in the body. So diabetes is also one of the metabolic disorder where hormonal will balance the sugar levels. So whenever the pregnancy, during pregnancy, when the patient with the pregnant lady comes to our clinic with the altered sugar level, it is like we need to examine further, and we need to ask the history related to family history is there or what. So finally, depending upon the history and examination, we will conclude the diabetes in the pregnancy. All the treatment aspects will be different for different kinds of the diabetes, like type 1 will have a different treatment parameter, type 2 will be different, and pregnancy diabetes is different. So This is regarding the different signs and symptoms and how we can
Diagnose.
diagnose with the history, general physical examination and the investigation. The last part is investigation is very important. So, whenever we have a history suggestive of the risk factors and the on clinical examination, if we find some abnormality related to particular organ involvement, we always advise the patient to go for a blood investigation. Whenever we give a blood investigation, especially in diabetes, we will give for a fasting blood samples and also HbA1c, which means that it will identify the blood sugar level over a period of 3 months. Okay, that is for diabetes. And hypertension, anyways, we are going to check the blood pressure and confirm that. We need to see for causes for hypertension, like dyslipidemia. Dyslipidemia means altered blood lipid values. So, we will give for dyslipidemia, so lipid levels in the body. Okay, these two are the blood investigation for diabetes and hypertension. And allow coronary artery disease, that is one of the major cause for non-communicable disease. For checking the coronary artery disease, initially we will advise one electrocardiogram, that is ECG. We will see any abnormalities are there or not, depending upon the symptoms of the patient. If ECG is fine, then we will not go further, we will treat symptomatically. Or if the symptoms are more prominent and they are having the symptoms for a very long time, then we will advise for echocardiogram. Echocardiogram means it is like nothing but one ultrasound of the heart. Okay. So, they will check all the heart parameters, everything. They will check the pumping action of the heart also. So, if it is fine, no need to worry. Then if it is showing any abnormalities, we will go further. So, depending upon the type of the involvement of the heart. Okay, there is one more type of test also for a heart. We will do a coronary angiogram. If it is really necessary, we advise the patient to go for a coronary angiogram. That is like if they really present with the typical heart symptoms. Typical means exertional chest pain, exertional breathlessness, or the chest pain which is there, which is increases day by day, which is mainly associated with the other heart conditions like palpitation. Palpitation is nothing but an increase in the heart rate. So, if it is associated with all these symptoms and also with the giddiness, we will think of it as predominantly the cardiac condition. So, we will treat accordingly. We will advise them, if it is necessary, the angiogram also. Angiogram will identify is there any block or not in the heart cardiac vessels. So, these are the different kinds of the tests we will advise for the patient to see for any abnormalities according to their symptoms.
So, doctor, once the diagnosis is done, how do we go about with the management or the treatment of these diseases?
Management mainly include what kind of disease. Once you diagnose the disease of non-communicable disease, we have to categorize the patient, whether it is a mild disease, moderate disease, and also depending upon the severity also. So, and whether the disease is there from a very long time or it is just now started. So, depending upon the lab values, depending upon the clinical symptoms and the clinical signs, we will categorize the patient. After categorizing the patient, we will think of starting the treatment. Usually treatment can be pharmacological or non-pharmacological. Pharmacological means we have to start the patient on medication. Okay. So, usually if there is too much of symptoms on that is correlating with the lab values, then it is necessary to start the treatment, especially if we considering the diabetes. If they have a symptoms and if in the lab, if their blood values are too high, the sugar is too high and they are having the symptoms, and if it is like there are complicating signs, like if it is involves the other organ, so it is always mandatory to start the treatment as early as possible. So, we will initially start with the very low dose of tablet concentration. There are different options, different varieties of treatment modalities are there for a diabetes. So, we can start with the tablet in a very low dose concentration. We will see whether the body adjusted to whatever tablet we start, we see the response. We will ask the patient to come back after 2 to 3 weeks of the treatment. Then we will see the response. We will give any again for the blood test. We will see is there any improvement in the blood values. If there is an improvement, we can ask the patient to continue the same tablet, he can come follow up every monthly.
Okay.
Okay. And if there is no improvement, we will increase the dosage, and according to the body response of the patient, we will adjust the dosage.
Okay.
So that is considering the tablet part. If the patient is not at all responding to the oral medication, we will ask for a insulin therapy in case of diabetes. Okay, we will advise there are different types of insulins are available in the market. We can adjust and advise the patient according to their socio-economic status, according to the need, everything we will see and decide what kind of treatment is required for the diabetes patient. This is considering to the diabetes, and we will ask them to follow up, because in case of non-communicable disease, follow up is very important, because these diseases cannot be completely curable. This needs to be the treatment usually needs a long-term history and long-term follow-up. So we ask the patient to for a follow-up, we will examine, we will see the response, and also we will find for any complication. If it is there, it is always advisable to check before and treat it.
Okay.
So along with that, we will advise regarding the prevention of the complication and other risk factors and modification of various risk factors, how we can change their lifestyle, their diet, other forms. So treatment is nothing but not only the pharmacology, other things also we will explain. So along with the pharmacology, other modification also they have to do in their lifestyle, so that it can be it cannot be cured, but it can be controlled very well for around 20, 30. There are a lot of patients who are on the tablet for very long periods. Okay. So this is about diabetes, because I am talking about diabetes because this is one of the majorly seen in patients.
Yes.
Okay. So considering hypertension also same, pharmacology therapy is there. We have to start the treatment as early as possible to reduce the blood pressure.
Okay.
So once we start the treatment, we follow up them, we will see that the blood pressure is under control. Okay. Along with that, we will see for other complication, because all the non-communicable diseases, not only they themselves have an effect on the body, it will cause other problem also, it will have the effect on other system also. So overall we need to see all the complications, side effects, everything we have to monitor. That is the reason we ask the patient to come for a follow up. Okay. So and for considering the treatment for malignancies, usually there are the cancers which can be preventable and the curable if we diagnose them earlier. So especially the breast cancers. So if you find any ulceration or any lump in the breast, and if we get to know after examination there is a change in the breast, so we usually advise for a further investigation just to confirm that there is a malignant or is just a benign tumor. Okay. So depending upon that, the treatment has a variety of treatments are there. So we will further advise them the treatment modalities. Okay. So this is about malignancy, diabetes, hypertension, and one more is a chronic respiratory condition that we will have to categorize, because chronic respiratory conditions they can have a different symptoms, like as I told, chronic breathlessness can be there, or a chronic cough. So we have to categorize and we have to diagnose depending upon the investigation and clinical examination. Then the treatment also varies depending upon the symptoms. Initially we can treat symptomatically, but once we diagnose the case, we have to treat appropriately. And also in the respiratory condition, the cause is very important, causative factors like chronic smoking, tobacco smoking. It has a very bad effect on the body, not only the lungs, other parts also. So it is always we advise the patient to stop the smoking, and we will give alternative suggestions, like alternative preparations are there, so that he will not go for acute changes in the body, because if we ask the patient to suddenly stop smoking, it is not possible for them. So we will have alternative options that we will advise them, so that they can slowly come out of the problems. So and along with that, we will advise the treatment for their symptoms. Okay. These are related to the respiratory problem. Okay. And alcoholism can cause an effect on the body, like chronic liver disease can happen. So in that condition, we will categorize it acute or chronic condition, or whether it needs emergency treatment or not. So we will assess the patient, see the condition of the patient, and treat accordingly for alcohol related issues in the body.
Okay. So doctor, in case person is suffering from certain symptoms or signs, as you mentioned, but they are not willing to visit a doctor, what could be the complications they face in the long term?
Yeah. So, especially in this non-communicable diseases, no, since it has a very long course and a slowly progressive disease, it will have a chronic effect on all the body organs. So, we can categorize mainly as a acute complication and a like long term complication.
Okay.
Acute complication, considering the diabetes, it can have like it can go for a hyperosmolar coma. Okay, hyperosmolar coma means nothing but a diabetes is there for a very long time, and if you are neglecting the symptoms and you are not ready to go for to the doctor, then it there will be a persistent high sugar level in the body. At the end, what happens, body try to reduce the sugar by removing into the urine or by other ways and trying to show the symptoms by excessive thirst or excessive urination. But even if we neglect such symptoms, it can go for a coma, hyperosmolar coma. Or it can go for diabetic ketoacidosis. Ketoacidosis is another form of complication, which is acute complication of diabetes. They can present with the loss of consciousness, because the coma is nothing but the high sugar when it enters to the brain, they can have a loss of consciousness, and the body sugars will be very high, and the ketone bodies are nothing but an end product of our metabolism, that will be too high in the body. So, it is not good for the body, it will have a effect, very bad effect on all the organs. It can affect the heart. Because of that, patient can go for a cardiac arrest. Okay, so different form of impression it can have all over the organs. So, even the kidney, it can go for a renal failure. So, we need to diagnose as early as possible. When the patient come to the casualty, diabetes can have that kind of coma, either hyperosmolar coma or ketotic coma. So, we need to treat accordingly. Immediately we need to see for sugars and see the patient condition. If there is any seizure can happen. Okay. So, these are the major complications of diabetes if we do not go to the doctor, if we neglect the symptoms. And considering to the hypertension, they can have acute complications like intracerebral bleeding. If there is a hypertension for a very long time, there will be a bleeding in the brain, because high blood pressure can cause a rupture of the blood vessels, any part of the body, especially in the brain. Okay. So, it can have an effect on the heart also. Long term high blood pressure can have an effect on the heart. So, that is also one of the major complications. It can cause acute cardiac arrest, possible, or acute, as I told, is a bleeding inside and can lead to a stroke and paralysis. These are the acute complication of hypertension, and it can have effect on the kidney also, renal failure possible. Okay. So, these are the acute complication of hypertension. It can long term, it can have a effect over the kidney and heart, other system also. So, that will be seen after a very long years. They will slowly manifest, but acute complications are always dangerous. Okay. So, even cancer usually it is a long process, slowly it will develop in the body. It has a slowly, sometimes it can have acute complications like hypercalcemia, it can have a bleeding, okay, and it can have a seizure, it can have other complication also considering the cancer. Respiratory, it can go for a respiratory failure, and patient can have a seizure because of the hypoxemia, because of the chronic cough, and emphysema. All those are the complications of these non-communicable diseases. Main thing is that we need to see for it. Okay, whenever there is a symptoms, it is always advisable to go and meet the doctor. If it is not neglected, then we can go for these acute complication and also the chronic complication. Chronic complication overall, they have like especially diabetes, they can have a neuropathy, retinopathy, nephropathy and all. That will develop usually after 10 to 20 years. Okay, so that will happen in a very slow progress, but if it happens, it is difficult to reverse it. So, chronic complication also have an effect on the health, and also it will have a mortality ratio also very high. Okay. So, disability is also very high if you are not treating the disease properly. So, we should be very careful about the symptoms and the signs of complication also, and the disease per se.
Yes. So, doctor, you said we have to be very careful about the signs and symptoms. So, what could be those red flag signs that we have to look for, that immediately we have to visit a doctor?
Yeah, as I told before, like in a for a general public, there are few symptoms and the signs which you can identify, and so that if it is there, you have to consult a doctor,
Okay.
so that at least we can treat the disease as early as possible. So red flag signs are nothing but if you have a persistent occipital headache,
Okay.
visual diminution of the vision or visual disturbances,
Okay.
or giddiness, persistent giddiness, or history of fall.
Okay.
So, and there is a bleeding anywhere from the body, especially the GI bleeding, vaginal bleeding, or weight loss. Okay, inappropriate weight loss,
Okay.
excessive weight loss, loss of appetite. These are the red flag signs of this cancer and this thing. If you have a excessive urination, as I told before, excessive urination, excessive like loss of appetite, all those things you can consider for diabetes.
Okay.
Okay, these are the red flag signs you have to see for it, and if it is there, you have to consult your doctor, so that we can diagnose the patient early and we can treat as early as possible. Because only worry in non-communicable disease, if it is diagnosed in a very late stage, it is slightly difficult to cure treat in a completely. So because if it is there for a very long time, it can have a effect all over the system, so it is very difficult to treat also for the other organ involvement. So always it is advisable to see for a risk factor and see for these red flag signs and consult a doctor and treat and take a tablet appropriately. One more thing in this non-communicable disease, because it is not curable, it has like a communicable disease, it has a very long course, no. So patient, they tend to stop the treatment because they think that taking a tablet for a very long time can have an effect on the body, side effect. But that is not usually happens. What happens is when they try to take a tablet for 2 to 3 months, then they think that it will get over, then there will not be any much problems, they stop it. But if they stop it, the effect on the body will be too much, because they have to continue the tablet to maintain the balance, especially considering the diabetes. If you stop the tablet suddenly, there will be a shooting of blood sugars and other metabolic parameters, especially hypertension also. If you suddenly stop the tablet, suddenly shooting of blood pressure will be there. So it has a very dangerous effect on the body. So it is always advisable, if you start a tablet, it is advisable to continue the treatment forever. Okay. In between stopping is not advisable. Okay, that is a major thing what we see usually day to day practice. So it is always advisable to continue the tablet, and routine follow up is important, and also the routine blood investigations and checkup, that is important to see for any complication. So if we diagnose early, we can treat early, and we can prevent the disease as early as possible and prevent the disability also. Disability is a major burden for the family also, because whenever there is a disability, the income source, everything will come down, and it is not good for the family, and income will be very less. So overall the burden will be too much. So it is always advisable to consult doctor as early as possible.
Yes, true, doctor. As you said, most of the non-communicable diseases are not totally curable. It's just to be controlled. So I think the most important aspect is to know how to prevent them. So what would be your advice on how to prevent them, especially the modifiable risk factors, how to handle them?
Yeah. See, as you said, it is not curable, but it can be preventable. That is the happiest thing about the non-communicable diseases. We can completely prevent the disease happening. So prevention, considering the prevention, there are different kinds of prevention modalities are there. We call it as a primordial prevention, primary prevention, secondary prevention, and the tertiary prevention, depending upon the patient situation. Usually primordial prevention is nothing but it's preventing the like risk factor, like development of the risk factor especially. So the risk factors, as I told, like prevent modifiable, non-modifiable risk factors are there, no? Especially considering the modifiable risk factors, like healthy lifestyle, unhealthy lifestyle, or unhealthy diet patterns, smoking, alcohol consumption, all these are the modifiable risk factors. We have to educate in the system so that they will know about the consequences of the risk factor, so that they will prevent the risk factor in the form of, they will not try this consumption of the alcohol, they may not try the smoking, they will avoid all these factors. And also the obesity, sedentary lifestyle, these are all the major factors which will have effect. So, so we will advise them regarding the mainly the healthy lifestyle. Healthy lifestyle in the sense, we always should have a balanced food, okay, for appropriate normal health. So balanced food is nothing but around 40% is mainly a carbohydrate, 40% is protein, and very less quantity, 20% fat consumption. So nowadays what happens is, because of the urbanization, globalization, what happens is our lifestyle and the diet has completely reversed.
Yes.
Because everywhere there are fast foods available and it is easily accessible.
True.
So, and our lifestyle also has become sedentary. We do very less exercises, we do go for a walk, and all it's very less nowadays. So our life has become very complicated because of these urbanization and globalization. So what we advise them, just before the occurrence of the risk factor only, we will tell them what are the risk factor, how you can prevent the development of the risk factors.
Okay.
That is called as primordial.
Yes.
So that the disease cannot happen, disease may not happen in the future. Okay. So they will try to change their lifestyle, like regarding the diet, as I told, more of vegetables and the fruits, that is very important because it contains lot of antioxidants. So it is always advisable to take a lot of vegetables, fruits, and cereals, pulses, they are very good for the body. And less of fat and fried items, and meat also. Considering the meat, red meat is not that much good, you can avoid, like you can avoid consuming the red meat, the frequency you can reduce.
Yes.
Okay, so less of red meat, more of vegetables.
Yes.
That will have a balanced effect on the body.
Okay.
And considering the oil and fried items, we should take very minimally. It is, I will say that it is better to avoid it, because long term fried items, oily items and all, no, and the bakery items and fast food, they contain lot of oil, saturated fats, no, that is not good for the body. Okay, it will have a long term effect. So it is to prevent the non-communicable disease to happen in our body, it is always advisable to have a balanced diet like this. So more of vegetables and the natural foods, then less of the fried food and the fast foods. Okay, and one more thing is that water is very important for the body. So as much as required, you have to take a water, up to 2 liters, 3 liters is fine, because that is the main source. Around 70% our body contains water. We need water for everything. So avoiding the water, instead of that taking the carbonated drinks like other things. So it is always advisable to avoid such carbonated drinks, and better to take a water as much as possible. And also the fresh fruit juices are there, so they can take that. So that is a balanced diet. So the healthy diet, you have to follow the healthy diet. And also along with the healthy diet, lifestyle like exercises. That is very important. Why I am giving more time for these prevention is because always these diseases can be prevented. So if we educate the general public regarding the prevention aspect, no, that is always good. So they can, after listening to these, they can try to follow these preventive modalities, so that they can be healthy forever.
Yes.
Okay. So one more, considering, as I was telling, like the exercise pattern. Exercise is very important for the body. Usually you can do at least 10 to 30 minutes exercise per day. Exercise in the sense, your heartbeat should go, heartbeat should increase. Not like simple walking will not help much, but like vigorous walking, brisk exercises, running, jogging, or any swimming, playing, these are all the exercises where your heart rate will increase. So that will help a lot than simple walking. Okay, the exercise makes a lot of difference in the body. So there will be a much of oxygen into the body when you do a exercise, and it will have a good effect on the body. Okay, and it will help in reducing the cholesterol. Obesity will come down, and all the complication of obesity also will come down. So that is paramount to consider the daily exercises in the our day-to-day activity. Okay, so at least half an hour, 1 hour is enough for the healthy life. So you have to follow consistently, not like doing for 1 week or 1 month. You have to follow this throughout the life. So along with the diet and exercise will give around 90% we can cure the non-communicable diseases. 10%, as I told, there are non-modifiable risk factors like heredity, family history. For that we cannot do anything. If there is a family history already having diabetes, hypertension, even if with the strict diet and exercise, they can get diabetes, hypertension and certain cancers. So we cannot do for such. We have to diagnose, we have to tell the patient before only to come for regular follow up, so that we can check the symptoms and the sign, so that we can try to reduce the complication, we can treat accordingly. So this is just a 10%, but around 80 to 90% the modified risk factors are there. We have to educate the everybody regarding the same symptoms and sign. That is about primordial prevention. Next, coming to the primary prevention. Primary prevention means already there is a risk factor, so already happened in the body, in the sense they are trying to that, and we are educating them just about the all the modifiable risk factors, so that they can stop that risk factor immediately.
Yes.
So already there is a changes in the body, so in future occurrence of the disease can be delayed, or the complication can be delayed by stopping or halting the whatever risk factor is there.
Okay.
That is called as primary prevention, because already it has happened, we cannot do anything, but as of now if it is there we can stop it. That is a primary prevention.
Okay.
And one more thing is that secondary prevention. Secondary prevention means already there is a disease, in the sense disease is already diagnosed, like patient is diagnosed with the diabetes, hypertension. So what maximum we can do is no need to worry too much about the disease and its complication regarding the medication and all. We can completely control the disease as such. Even though we cannot cure it, we can control for a very long years with the proper intake of the medications.
Okay.
It can be pharmacological, non-pharmacological depending upon the disease, but we can control the disease in a very good manner if the patient take the tablet and the advices from the doctor in a very good manner. Okay. So they can continue the tablet, and they have to come for a follow up, and we will examine if there is good improvement and good follow up, they can live very longer, because there may not be any complications with the good secondary prevention. Secondary prevention is nothing but given the treatment for a particular disease according to the patient history and examination.
Yes.
So next is a tertiary prevention, which has a very less effect on the body, but what we can do is tertiary prevention is nothing but preventing the disability and the death. Already there is a disease and it is like a very has a long course, but still it can cause some complication, disability and death. Disability is like, example if can tell, like in a coronary artery disease or cardiovascular disease, they can have a stroke and paralysis.
Yes.
Okay. So paralysis is, once it has happened, especially like hemiparesis or anything like that, they have to live with the paralysis lifelong.
Yes.
So there are different modalities, because there are centers where he can ask the patient for regular exercises, so that we can increase the strength of the muscle in case of paralysis. That is called as disability, because in case of non-communicable diseases, if it is not treated properly, they will have a disability. Disability is also a huge burden to the family, because they cannot go for a work and the expenses will be very high. So for that we need to treat it, that is called as tertiary prevention, by either regular exercises, we ask the patient to do exercise, or physiotherapy we ask the patient to do, and in case of bedridden patients we ask the patient to change the position. These are all the tertiary preventive measures to prevent the disability and the death.
Okay.
So, okay, see, these are all the different modalities of preventive measures. These are very important than other treatment, other things, because we have to prevent the disease, because in this case we cannot cure the disease completely, we can prevent the disease, which is very important for our life.
True. Thank you very much, doctor, for spending your valuable time with us and giving us an overall idea of non-communicable diseases. Definitely, doctor has given us a very important reminder. I hope this episode was helpful for all of you. Stay tuned to BMC Global Live for more such informative episodes. This is Marina Francis signing off. Keep smiling, keep learning. Good night.
16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.